Hi, I'm Brandon Steen, orthopedic surgeon with Florida Orthopaedic Associates. I specialize in shoulder surgery. Today, I'm going to answer some patient questions about shoulder replacement surgery. Tom asks, how successful are shoulder replacements? So shoulder replacements, there are two separate types. Both replacements have very similar outcomes as far as their success rates. In both groups of operations, both anatomic and reverse, we have approximately a 95 to 97% success rate in achieving patient satisfaction after surgery. Complication risks are approximately 1 to 2% with both operations. As far as pain relief goes, both operations have been shown to reduce patients' preoperative pain by approximately fivefold. Typically, we measure pain on a pain scale from 1 to 10. Patients who come in with a pain of 7 or 8, say, typically have a result averaging approximately 1 to 2 after surgery. As far as motion goes, most people that require shoulder replacement have substantial loss of motion from both stiffness and weakness in rotator cuff tears. In both operations, you can expect to achieve approximately 80 to 90% of normal motion in that shoulder after shoulder replacement. Typically, satisfaction rates are very high because of pain relief and improved motion after both reverse shoulder replacement and anatomic shoulder replacement.